Schizophrenia by Ravonda Lewis. Schizophrenia is a serious brain disorder that distorts a person's ability to think clearly, act, manage emotions, make decisions, and relate to others. This mental illness affects about 1% of Americans. Women, men, and children can all be affected by schizophrenia. Most of the time, there is not a diagnosis of this disorder after the age of 45. This mental illness, however, is more difficult to diagnose in teens. One difference in social location is evident by blacks in the U.S. being 200% more likely to develop schizophrenia than whites. African Americans and Latinos are more likely to be misdiagnosed as a probable result of cultural and religious beliefs or language barriers. Causes of schizophrenia. There's a website that can be found listed below, a WebMD website that can give you more causes of schizophrenia. But some of them listed were genetics, environment, brain chemistry, and substance abuse. There is not one gene that causes this disorder, and chances increase by 10% if you have a first-degree family member, like a parent or a sibling that has it. Exposure to virus or malnutrition can cause the disease. Neurotransmitters may also contribute to schizophrenia, and taking mind-altering drugs during teen and young adult years can increase the risk of psychotic incidents. People with schizophrenia may exhibit negative and or positive symptoms. Some negative symptoms listed on the slide include slow movement, changes in body language, change in sleep patterns. Some positive ones are hallucination, disorganized thinking, delusions. Negative symptoms pretty much diminish a person's abilities, their day-to-day activities, and positive symptoms are more psychotic. People are affected by schizophrenia in various ways, but families have to deal with members that have this disease, and some of the ways they found to cope are support within their own household. Everybody tries to support the person. Support from family and friends, extended family, and community resources and support. The effects of this illness can either be treated, and some function very well, but the end result, if left untreated, can even be suicide. Some people go on to college, have jobs, families, are married, but some end up homeless, alone, criminals. The reason they're listed as criminals is because sometimes our society and justice system don't know how to deal with people with mental illness appropriately, and they think they're criminals rather than need help mentally, and so they throw them in jail. Some of them even end up alone and dead because they have no family members to take care of them. The next few slides are going to speak about gender and schizophrenia. This is from a woman versus man perspective. An article of reference for these points can be found if you log on to the UNCG library and look for an article entitled Sex Differences in Schizophrenia with the authors Catherine Abel, Richard Drake, and Jill Goldstein. Many psychiatrists believe women first experience the onset of this mental illness at a later time, but also have a better course of the illness than men. Women diagnosed is usually diagnosed between about 25 and 30 years old, men about 18 to 25 years old. A study presented that women were more likely to have depressive symptoms and less likely to show the negative symptoms that inhibit their personal abilities. The prominence of the affective symptoms in mentally ill women may show a likelihood that women are more likely than men overall to express these affective symptoms, and therefore the difference in expressing symptoms may be gender related. Women with older onset than some men with older onset may have more paranoid symptoms. So older onset and affective symptoms predict a better course for female sex in most studies compared to men with the young onset, negative, and disorganized symptoms. But there is not strong evidence that sex or age can predict the course independently of precisely assessed symptoms and their profile at this time. An article that I used for my intervention is Gender Differences in People with Schizophrenia in Rural China. The link is listed below. The intervention discussed was family support and antipsychotic drug treatment for men and women. Target population of the intervention was both males and females. It discussed how men and women respond long-term when they have or do not have family support. This article accounts for intersectionality because it speaks to the matter of both male and females, along with mentioning socioeconomic status and its influence on long-term results. This article or intervention connects to my presentation because it represents information on how gender can influence schizophrenia. This intervention was connected to the content I selected for the class to review because it discussed the long-term results of treatment for both men and women. The article I chose for review discussed how gender has an impact on the severity of schizophrenia. Gender is positioned in this health issue because there has been information presented to suggest that there is a better outcome for the course of this mental illness for women more than for men. Also, the intervention of family support was shown in the study to help impact the long-term results of women and men. There was more family support for women, and this helped the women to have a better health outcome than men, as a lot of the men in the study were divorced or alone. Some of the references that I use, or all of the references that I use for the presentation, are listed in this slide.